The man is in his...
Whoever guesses the reason they went code black wins a pot.
Ah, interesting. We didn't do this at the VA.
Yeah.
Game?
Of course.
Now, how's this look to you?
My wager is on flooding. They're going to be down for 3 hours, and we're going to get 20 of their patients.
Put me down for flooding, 4 hours and 30 patients.
Okay. Hey, Dr. Rob, looks like you got some competition.
Yes, it would appear that I do.
All right, guys and gals.
Dr. Santos, making progress on your charting, I hope.
Getting there. Deficient charts leaving.
Oh, I'd hate to delay billing.
Timely documentation is essential. Let's fix this before end of shift.
I'm on it, boss.
Good. You wouldn't want to repeat your R2 year again because of this. Victoria, if his CT's normal, he'll need an LP.
Got it.
Dr. Al-Hashimi?
That doesn't make any sense. What happened?
We're still trying to piece the story together. He was brought in by a campus security guard who tased him after he was allegedly
Tased him?
combative and violent.
Wait, what do you mean tased him?
We've treated his injury, and now we're trying to understand why he was so agitated.
Okay, this doesn't sound like my brother.
Well, his drugs.
You can't go into the CT, but you can wait for him to come back, and then we can discuss next steps.
Okay.
For occupational exposure, the rapid HIV test takes an hour or two.
It's a PEP if you want while you're waiting for results.
Start a chart, and I'll find another nurse for your blood draw.
Great.
Looks like we've got a couple more diverted from Westbridge.
Any...
Time to pull Dr. Langdon from triage?
No. First day back. I want to let him kind of ease into things.
Understood. I'll keep an eye on it.
Thank you very much.
Thinking about changing your vet?
I am just weighing my odds.
Don't worry. I'll buy you a drink with my winnings. Nice job on the tap. Thanks.
Hi.
We did. I'll let Victoria present the case.
This is Jade.
A really strong antibiotic to kill skin germs.
Need a hand?
No. We got this.
I'll just observe. Pretend I'm not even here.
Let's sit tachycardic. No evidence of SIRS. Yet.
What's SIRS?
Systemic inflammatory response syndrome. Sorry.
An exaggerated defense.
This is Dr. Michael Rabinovich. I am the chief of emergency medicine at PTMC.
To your parents yet?
Yeah, they're on their way back from Columbus.
Maybe you should take some time for yourself before they are.
Decent grilled cheese. Stay away from the tuna.
Thanks, but I'm not hungry. You know, I just can't believe that a campus security guard tased my brother. Protect them, not shoot at them.
You have every right to be upset, and you should absolutely pursue accountability. But right now, we are taking care of your brother.
6/84, pulse 102, good sats, 95 on Romero.
How you feeling there, Mr. Varney?
Airways patent.
Good lung sliding on the left.
118/78, heart rate 112.
Tachycardic from the pain.
Start with 4 of morphine, repeat PRN.
On it.
Okay, swollen mandible. Open your mouth for me, Gus. Little wider. Can't.
Whitaker, you know the tongue blade. All good in there?
Code sepsis. Stable for the moment. How about you?
Perfect vitals, EFAS negative, off to CT.
Good. Keep me posted.
Ditto. You good?
Yeah, good.
You sure?
Doesn't seem like Robbie's all that happy I'm back.
Well, he's not going to be here, and I'm happy you're back.
Thanks.
Ready? And 1, 2, 3.
Anterior rib fractures and a small pulmonary contusion.
Not too bad. When do pulmonary contusions peak?
After a few hours.
And do we always admit for a 3-rib fracture?
In the elderly, yes, but not if a patient can manage the pain and doesn't need supplemental oxygen.
Good.
Okay.
Get Mr. Varney prepped and draped. Dr. Mohan, you're in charge.
Let's
I'll keep you posted.
Hey, you're kind of buds with Gloria. Did she say anything to you about what's happening at Westbridge?
No, you?
Nope. How are your patients?
Our prisoner Gus has stable injuries, and our law student in Central 10 is awake, normal LP, and awaiting a psych consult.
Good. Quicker we can treat them, street them, move them up the food chain, the better.
Question. Why are you treating me like one of your residents?
I'm not. As the attending, I'd like to know the status of all the patients and doctors in the ED in case I need to jump in quickly.
Makes sense. Now your turn.
What?
As your fellow attending in our ED, it only makes sense for me to know the status of all the patients and all the doctors, in case I need to jump in on a moment's notice.
Touché.
That just tore right through the skin.
May need to take bigger bites farther away from the wound edges.
Skin seems pretty fragile. Oh, yeah, this is not working.
He has the skin strength of an 80-year-old.
Put down steri strips with benzo in, not across the wound, but along each wound edge, both sides. It'll hold the sutures.
Yeah.
What say you, Dr. Robbie?
Great. MacGyver move. Go for it.
Just it.
I'm catching up on my charting as fast as I can.
Why don't you give my generative AI app a try? It's 30% more efficient, and providers report increased job satisfaction. And you'll rarely have to stay overtime to complete charts.
Yeah? Okay. Yeah, I'm usually here at least a couple hours after every shift trying to catch up, so.
Sure, AI will make doctors more efficient, but hospitals will expect us to treat more patients without any extra pay, of course, all the while eliminating staff positions for attending and residents.
Oh, Dr. Robbie, I am not an advocate for erasing my own profession, but I am advocating for getting to spend more time with my son. Nothing can replace family. Starting your sabbatical early?
I know somebody who could really use a drink right now.
In the hospital?
As a parting gift.
Decide if Mr. Varney needs surgery.
Have they even come down to examine him in person?
No, they must be backed up.
Or there's a July 4th sale at the BMW dealership. Probably jail cuisine. Whitaker, what labs should we add?
B12, folate, iron levels.
Good. We're gonna run some more tests, Mr. Varney. Hang in there to be thorough. What's in the differential diagnosis for malnutrition?
Inadequate intake, methamphetamine use.
What is the story with your incarcerated patient?
Gus Varney, 3 rib fractures with normal O2 sats currently, waiting on CT results.
Okay, if he's stable at the 2-hour mark, I'd say he's good to go. Let's get the ball rolling on discharge.
Let's wait on the CT results.
We can move him out of trauma 1 at least.
Yes, we can. What's open?
13 and 14 will be discharged soon. 15 once we can move Louis to the viewing room and get it cleaned up.
A paracentesis patient, Mr. Cloverfield?
Defib arrest. We'll do a debrief when we know how many patients we're getting from Westbridge.
So Gus goes to 13, 14, or 15.
Gus here's wondering if he's clear to eat.
As long as it's a liquid diet. We have the results of your CT scan.
Your jaw should heal without surgery, which is good news, but it would.
I don't know. Don't count.
Pretty sure it's 3 trays a day.
Okay.
That disimpaction left a smell and stunk up the whole hallway. So grab some coffee grounds from the lounge.
We need to admit our incarcerated patient, Gus.
What did the CT show?
Moderate pulmonary contusion, 3 rib fractures, no intra-abdominal.
Liquid diet, pulse ox a few times a day, and then also dressing changes for the laceration.
Which he can get at his correctional facility.
Or he stays here for a few days and we get him on the right track to healing.
Why don't you two go check on your patients?
Sure thing.
What am I missing?
He's not getting enough to eat at his correctional facility. The portions are tiny, too many carbs, not enough fruits or vegetables. He's lucky he hasn't developed a chronic illness.
We don't have any
Al-Hashimi, Dr. Jefferson wants to talk to you about our taser kid.
Why don't I call the prison doctor and find out what they're working with over there?
Thank you.
My pleasure.
What's the sister doing?
Still pretty upset. Just never seen him like this.
It's a lot to process. How's he doing?
He's scared. Off the phone with the physician assistant at the prison. They've got a 16-hour-a-day infirmary with NP and PA coverage, giving everything that we need, and they've got an RN for overnights.
Even so, he's here because they're ignoring his basic needs.
He's here because somebody kicked the shit out of him.
I think you're missing the point. We have more to offer.
Robbie, got 4 more coming our way.
Okay, got it.
Why not send him back to the street with antibiotics and a roll of gauze?
Because Digby lives on the street, and your incarcerated patient has a mid-level provider and a nurse looking after him.
We both know the quality of care is not the same.
Sorry, you waiting for me?
No, Dr. Al-Hashimi for the patient in 7.
A few days here could make a world of difference for Gus's health.
We are a safety net. But nets have holes. We are not admitting them because this is not about social justice.
Everything I've done in my career is an effort to improve the system. Just because you know it's broken doesn't mean you stop trying. Excuse me.
3 ounces of formula without vomiting or distress.
Excellent. Dr. Wolk from Pitt should be down shortly.
I think I saw her smile.
A true social smile where the baby is awake, alert, and responding to facial expressions usually doesn't happen until 6 weeks or older. It was likely a reflex smile that happens while they're sleeping. But some parents have reported their babies smiled socially as